Hey everybody, welcome back to Shock Doc Medical. I'm Dr. Rod, and today we're diving into a truly eye-opening study that could change the way we think about something as common as a runny nose or an earache. Have you ever stopped to wonder just how big a deal upper respiratory infections are? And what about that pesky ear infection, otitis media, that so many of our little ones suffer from? Buckle up, because today we're breaking down the Global Burden of Disease Study 2021 on upper respiratory infections, URIs, and otitis media. And trust me, the numbers are nothing short of staggering. All right, let's kick things off. URIs are the leading cause of acute illness worldwide. They're practically everywhere, affecting billions of people every single year. And while we might brush them off as a minor inconvenience, the reality is they contribute to a massive global healthcare burden. Now, this study didn't just look at URIs in isolation. It also examined otitis media, the common ear infection that often follows URIs, especially in kids. And guess what? The research spans data from 1990 all the way through 2021, covering 204 countries and territories. That's a whole lot of data to chew on. Let's get into the nitty-gritty. In 2021, there were an estimated 12.8 billion episodes of upper respiratory infections worldwide. Can you imagine that? From the common cold to more serious throat infections, that's a staggering number of cases. And it translates to an incidence rate of about 162,485 per 100,000 population. Now, here's an interesting tidbit. From 1990 to 2019, this incidence rate actually dropped by around 10.1%. And then from 2019 to 2021, it dipped a little further by 0.5%. So despite all our advances, these infections are still running rampant, especially among our youngest populations. Now, if we break it down by age, children really take the hit. The highest incidence rates were seen in kids under 2, with those aged 12 to 23 months hitting a rate of roughly 328,645 per 100,000. And then there are tons of episodes among children aged 5 to 9 years, about 1.5 billion episodes in that group alone. For older kids and young adults, the numbers are still significant. For instance, those aged 15 to 19 years have an incidence rate around 160,574 per 100,000. It's like URIs are the ultimate equalizer. No matter who you are, chances are you've dealt with one. Now, I know what you're thinking. Dr. Rod, I've had a cold a dozen times this year, but it never bothered me that much. And you're right, URIs rarely lead to death. In fact, in 2021, there were about 19,600 deaths globally, which works out to a mortality rate of just 0.2 per 100,000. But here's the kicker. While the death toll is low, the overall burden in terms of lost healthy life is huge. The study estimated around 4.41 million years lived with disability, YLDs, due to URIs, and 1.27 million years of life lost, YLLs. When you put it all together, URIs accounted for roughly 5.68 million disability-adjusted life years, DAYWs, in 2021. That's a huge impact on quality of life in healthcare systems worldwide. Now, let's switch gears to otitis media, that annoying ear infection we all dread, especially when it hits our kids. Globally, in 2021, there were about 391 million episodes of otitis media. That's right, nearly 400 million cases. The incidence rate here was around 4,959 per 100,000 population. And just like URIs, the highest rates are in young children. The peak incidence for otitis media was in kids aged 12 to 23 months, with a rate of about 30,405 per 100,000, closely followed by children aged 6 to 11 months, and even those as young as 1 to 5 months. Interestingly, when it comes to sheer numbers, the largest group of otitis media episodes occurred in children aged 2 to 4 years, roughly 98.6 million episodes. And although otitis media rarely leads to death, in 2021, there were only about 536 deaths globally, with a mortality rate of less than 0.1 per 100,000. It still takes a huge toll in terms of disability. Otitis media caused about 2.45 million YLDs and around 28,200 YLLs, culminating in roughly 2.48 million dailies. Now here's where things get really interesting and a bit alarming. When you combine the burden of URIs and otitis media, the total impact is enormous. Together, these two conditions accounted for about 6.86 million YLDs and 8.16 million DALYs in 2021. The age group most affected in terms of disability? Children aged 5 to 9 years, who alone contributed nearly 925,000 YLDs and almost 1 million DALYs. And if you look at the daily rates per 100,000, infants in the 1 to 5 month age group topped the chart with a rate of 647, followed closely by early and late neonates. These numbers really drive home the point that while URIs and otitis media might seem like minor annoyances, their collective impact on public health, especially in the most vulnerable populations, is massive. Let's take a quick global tour. The study found that the highest incidence rates of URIs in 2021 were in regions like high-income North America, Oceania, and tropical Latin America. However, when it comes to the sheer number of episodes, middle SDI regions, that's sociodemographic index for you, took the lead with about 3.85 billion episodes. On the flip side, the highest mortality rates for URIs were seen in Eastern, Western, and Central Sub-Saharan Africa. For otitis media, the highest incidence rate was observed in Western Sub-Saharan Africa, and low SDI regions recorded the highest number of episodes and rates. And if you're looking at the combined daily rates, Eastern Sub-Saharan Africa again comes up on top, with Somalia, Central African Republic, and Burkina Faso showing the highest figures. Now, you might be wondering, what's driving all this? The study didn't just stop at counting cases, it also looked into the risk factors behind these conditions. For URIs, 4 key risk factors were identified. Low birth weight. In 1990, low birth weight was responsible for about 57,600 DALYs, and by 2021, it still topped the list with 26,500 DALYs. Short gestation. This contributed about 11,600 DALYs in 2021. Household air pollution, another big one, adding around 9,200 DALYs. Ambient particulate matter. This factor contributed roughly 2,510 DALYs. For otitis media, the picture is slightly different. The major risk factor here is secondhand smoke, which in 2021 was responsible for about 79,600 DALYs. Following that, low birth weight, household air pollution, short gestation, and ambient particulate matter also played roles, though to a lesser degree. It's clear that these risk factors, many of which are linked to socioeconomic conditions, are major contributors to the global burden of these diseases. Let's bring it home for a minute. While URIs might not often be fatal, they're the #1 reason people miss work, children miss school, and healthcare systems get overwhelmed. Imagine the ripple effect. Parents scrambling to take care of sick kids, increased use of antibiotics, leading to antimicrobial resistance, and even the economic strain on low-income families who can't afford to miss work. And for otitis media, aside from the discomfort and pain it causes, there's the long-term risk of hearing loss, which can affect a child's development and quality of life. I've seen firsthand how recurrent ear infections can disrupt a family's life. It's not just about the doctor visits. It's about the sleepless nights, the missed opportunities in school, and the stress it places on everyone. And when you scale that up to a global level, you realize just how critical it is to address these issues through proper public health strategies. So what can be done about it? The study highlights several strategies that could help reduce the burden of URIs and otitis media. Hygiene practices. Promoting better hand washing and general hygiene can help reduce the spread of infections. Antimicrobial stewardship. Since URIs account for a huge chunk of antibiotic prescriptions, often unnecessarily, it's crucial to use antibiotics judiciously to combat the rise of antimicrobial resistance. Vaccinations. Vaccines, particularly the pneumococcal conjugate vaccines, have shown promise in reducing otitis media cases. Newer, higher valency versions of these vaccines are on the horizon and could further decrease the incidence of ear infections. Now, while the study doesn't dive into specific medication doses, it's more about prevention. In clinical practice, standard dosing for pneumococcal conjugate vaccines, for instance, might be given at 0.5 milliliters per dose according to your country's immunization schedule. But remember, that's just one piece of the puzzle. maternal and child health programs. By improving maternal health and reducing the rates of low birth weight and short gestation, we can tackle two of the biggest risk factors head-on. Reducing household air pollution. With over 2.3 billion people still lacking access to clean cooking methods, interventions to reduce exposure to solid fuels can make a significant impact. Public health campaigns. Educating the public about these infections, their risks, and preventive measures is essential. Tailoring these initiatives to the local context, because what works in one region might not work in another, is key. Now, for those of you who love the behind-the-scenes details as much as I do, here's a quick rundown on how this study was conducted. The researchers used a combination of advanced statistical models like Bayesian meta-regression and the cause of death ensemble model, or CODEM, to analyze data from thousands of sources, including vital registration and health surveys. They modeled both the non-fatal and fatal burdens of URIs and otitis media, and even broke down the data by age, sex, and geographical region. The sheer scale and precision of this analysis is mind-blowing, and it's a testament to how far global health research has come. Of course, no study is without its limitations. The researchers pointed out that in regions with scarce data, the estimates have wide uncertainty intervals. There's also the challenge of standardizing case definitions across different studies, something that can introduce variability. And then there's the impact of the COVID-19 pandemic, with some data potentially misclassifying COVID-19 as a URI, which muddies the waters a bit. These limitations underscore the need for ongoing research and improved surveillance to get an even clearer picture of how these diseases affect our world. But here's the silver lining. Studies like this lay the groundwork for targeted interventions and more effective public health strategies in the future. By understanding the detailed burden of URIs and otitis media, we can design better prevention programs, refine our vaccination strategies, and ultimately reduce the global impact of these common yet consequential infections. All right, friends, let's sum it all up. We learned today that upper respiratory infections are the most common communicable disease globally, with over 12.88 billion episodes in 2021 alone. Otitis media, while less deadly, affects hundreds of millions, particularly our youngest children, causing significant disability. Together, these conditions result in millions of years lost to disability, a heavy burden that ripples through families, communities, and economies. Key risk factors like low birth weight, short gestation, household air pollution, and secondhand smoke play huge roles in these outcomes. And finally, targeted public health interventions, from improved hygiene to better vaccinations and maternal care, are critical if we're going to make a dent in this burden. If there's one thing I hope you take away from today's episode, it's this. Even the most common illnesses can have a massive impact on our lives, and by staying informed and proactive, we can work together towards a healthier future. I'd love to hear your thoughts. Have you or someone you know struggled with recurrent colds or ear infections? What preventive measures have you found effective? Drop your comments below, and let's get a conversation started. If you enjoyed this deep dive into the world of URIs and otitis media, please hit that like button, subscribe to Shock Doc Medical, and share this episode with your friends and family. Trust me, the more we spread awareness, the closer we get to transforming public health. And hey, stay tuned. Next week, we're unpacking another groundbreaking study that might just reshape how we approach everyday diseases. Until then, I'm Dr. Rod, reminding you to stay curious, stay informed, and as always, take care of yourself and each other. Thanks for listening to Shock Doc Medical. Catch you next time.